bacon sandwich.
We were concerned as a team that we weren't actually providing an equitable service across the renal division, really. We knew that we were providing an excellent service to the ward, to Marlow ward, and also to the haemodialysis units regarding haemodialysis patients, but we knew there were areas that we weren't covering and our service wasn't equitable. We looked at the whole service completely. We looked at the time we were spending doing various things. We decided that we would only see our haemodialysis patients every 3 months, and we would also then provide a service to our peritoneal dialysis patients with the same terms of reference, i.e. that we would see them every 3 months as well. And by doing this, we were meeting the Renal Association standards where patients should be reviewed every 6 months.
35% of our PD patients were seen in accordance with the UK Renal Association guidelines, whereas now, following the benchmarking exercise, it's over 80%. So I think there is a massive improvement. I mean, she's been great to work for, she's been great to work with. She's involved us in every decision that has been made. She's keen to know what we have to say about improving our service to our patients.
Sue became matron in April 2011, having before that been community midwifery manager. On taking on the matron role at QE, she worked really hard to improve the environment that women were delivering in and being cared for postnatally, and in particular in developing the midwifery-led unit. Another development in the maternity unit at the QE this year, as a result of Sue's persistence at wanting to improve the environment for women and their families, is that partners or a significant other can stay with the woman throughout her postnatal stay. And Sue has embraced this and encouraged staff to embrace it, and it's working really well. The key thing about Sue is her energy and her passion to develop the service. She is tireless. She works endlessly to ensure that the service improves, and she encourages the staff she works with to embrace that ideal.
Chris Gedge is the Assistant Director of Finance, along with 4 other leads who provide support to the divisions. These 5 staff have transformed the nature of the work they do, and as a result of that, they're facilitating improved decision making within the clinical divisions. On a day-to-day basis, they're engaged with both service managers and frontline staff, and they're engaging with these individuals to ensure that we change the way we do business to both improve clinical care, record financial efficiency savings, and make sure that as we move forward, we're developing a surplus that can invest in the rest of the trust and improve the services we provide for patients. Over the last year, the trust has been through a major change management programme, and Chris especially, but Chris and his team have provided leadership in that area, both in terms of the way they do business themselves to support the clinical divisions, but helping the clinical divisions take this change management process forward, improve patient care, and lead to a more efficient and effective organisation.